Basic Pharmacology for Semester 5 of Medical School. Basic Pharmacology 1. Introduction to Pharmacology. Definition of pharmacology: the study of the interaction between drugs and the body, including pharmacokinetics, what the body does to drugs, and pharmacodynamics, what drugs do to the body. Relationship with other sciences, chemistry, analysis of the molecular structure of drugs. Physiology, understanding the effects of drugs on body functions. Pathology, utilization of drugs to treat disease. Toxicology, study of the effects of poisons and safe doses. Types of drugs based on their origin. Natural, example, morphine from the opium plant. Synthetic, example, paracetamol. Biotechnology, example, recombinant insulin. 2. Pharmacokinetics. Pharmacokinetics explains the journey of drugs in the body, including absorption, the process of drug entry from the site of administration, oral, intravenous, etc., into the bloodstream. Factors that influence pH, solubility, and route of administration. Distribution, drug distribution to body tissues. The role of plasma proteins such as albumin in binding drugs. Distribution to certain organs based on blood flow and membrane permeability. Metabolism, drug transformation, especially in the liver, phase 1 metabolism by 450 cypriot pounds enzymes and phase 2 through conjugation. Changes to active or inactive forms. Elimination, drug excretion through the kidneys, urine, liver, bile, lungs, or sweat. Factors such as kidney function and age affect this process. 3. Pharmacodynamics. Pharmacodynamics discusses how drugs produce their effects, drug mechanism of action. Drug interactions with receptors, agonists, antagonists. Effects on enzymes, inhibitors, activators. Effects on ion channels or transport proteins. Therapeutic and toxic effects. Main, desired, effects and side effects. Drug tolerance and resistance. Dose-response concept, ED 50, effective dose for 50% of the population. LD 50, lethal dose for 50% of the population. Therapeutic index, drug safety ratio, LD 50, ED 50. 4. Drug classification. Based on how it works. Agonists stimulate receptors, antagonists inhibit receptors. Based on organ system. Cardiovascular drugs, example, antihypertensives. Central nervous system drugs, example, antidepressants. Based on therapeutic category. Antibiotics, fight bacterial infections. Analgesics, relieve pain. 5. Drug interactions, pharmacokinetic interactions, the effect of other drugs on absorption, metabolism, and elimination. Pharmacodynamic interactions. Synergistic, strengthening or antagonistic, reducing effects. Interactions with other substances. Food, for example, grapefruit juice affects 450 cypriot pounds enzymes. Alcohol and cigarettes. 6. Side effects and toxicity. Side effects, unwanted reactions, such as nausea or dizziness. Toxicity, harmful effects at high doses. Overdose management. Administration of specific antidotes, for example, naloxone for opioids. 7. Pharmacogenomics, genetic variations that affect response to drugs. Study of metabolic enzymes such as 450 cypriot pounds that vary between individuals. 8. Principles of drug use, rational prescription, choosing drugs based on scientific evidence, safety, and efficiency. Risk-benefit evaluation, analysis of potential benefits versus risks. Patient compliance, efforts to improve compliance through education. Additional components, clinical case study. Drug interaction scenarios or side effect management. Practical, drug dose simulation using biological models or software. Final assessment, theory and practical exams. Group assignments in the form of drug mechanism analysis. By studying this material in detail, students will have a strong understanding of the basics of pharmacology that are important for clinical practice or